Lyme disease is a bacterial infection caused by a spirochete, Borrelia burgdorferi, and is transmitted to humans by the bite of an infected deer tick. It is an infection that is growing in prevalence, particularly in the northeastern United States, but also increasingly in other parts of the country. Deer ticks become infected when they feed on mice, birds, and other small animals that carry the bacteria. Once an infected tick feeds on a human, it deposits the bacteria into our bloodstream, causing a reaction. Symptoms of Lyme disease can range from mild to severe, making it difficult to diagnose and treat. It can cause severe fatigue, joint pain, and neurological problems, as well as a characteristic bullseye rash. Early diagnosis and treatment is important for preventing long-term complications from Lyme disease. There are several factors that can increase your risk of acquiring Lyme disease, such as living in wooded areas, participating in outdoor activities, and not taking preventative measures. The longer a tick is attached to the skin, the more likely it is to transmit the infection, so it's important to take precautions when in tick or deer habitats. Proper use of insect repellents, wearing long-sleeve clothing, and avoiding tall grasses or foliage helps reduce the risk of infection. Lyme disease is primarily spread through tick bites. Being bitten by an infected tick is the main way the disease is contracted, though there is some evidence of other methods of transmission. Tick larvae and nymphs, which are both very small, are most likely to spread Lyme disease. These immature forms of ticks are especially active in the spring and early summer months. Both humans and animals, such as pets, can bring infected ticks into an area, leading to an increased risk of Lyme disease. Human activities such as gardening or camping can bring an infected tick to an area and increase the chances of infection. The prevalence of Lyme disease is also higher among people who live near wooded areas where infected deer and mice are present. The Lyme bacteria can survive in different temperatures, climate zones, and habitats, and it can survive inside an infected tick for more than a year. Weather conditions may affect the risk of Lyme disease. Hot, dry conditions can slow the spread of the Lyme bacteria, while cooler, damp weather increases the chance of transmission. In the summer, ticks are generally most active in cooler, shady areas. Climate change is also thought to be contributing to an increase in Lyme disease cases, as it is changing the areas where the Lyme bacteria can survive. Other factors, such as the overuse of pesticides, can also play a role. The chemicals used in pesticides can affect the food chain of small animals, leading to an increased number of infected ticks. Disease-carrying animals, such as mice, can become more common if there is a decrease in predator populations.